This meeting is now in public. So I'm going to read you because we only have 20 minutes. I don't know if we can get resources to go beyond one, but we're checking. The clerk is checking on that. And so I'm going to read you Mr. Mazur's motion first. 6.5 million Canadians do not have access to a family doctor. Canada is short 23,000 family doctors and 60,000 registered nurses. Over 80,000 internationally educated healthcare professionals in Canada are not working in their profession. That pursuant to Standing Order 1082, the committee undertake a study on the impact of the federal government's immigration policy to healthcare and the barriers preventing the integration of internationally educated healthcare professionals into the Canadian healthcare system, that the study consists of no less than 6 meetings, that 1 full meeting be dedicated to the Minister of Health and officials, that 1 full meeting be dedicated to Minister of Immigration, Refugees and Citizenship and officials, that witnesses include the Canadian Post-MD Education Registry, CAPER, Royal College of Physicians and Surgeons of Canada, Medical Council of Canada, and internationally trained physicians, and that the committee report its findings to the House. Now you have the motion read. Is there discussion on the motion? We are not only going to decide whether you agree to the subcommittee adopting this motion, but you also have to decide at the end of the 3 motions on what your priority for the studies are. Which one goes first, which one goes second, which one goes third. All right, so open debate on Mr. Mazur's motion. Seeing no hands up, I guess I'm going to call the vote. So the clerk will call the vote.
Ms. Chi.
Oh, thanks. Are we ready to vote on the motion?
Yes.
On
Okay.
Mr. Mazur's motion.
Sorry, just a point of clarification. Is this the order of the motion or just a
No,
motion?
just a motion.
Oh, just a motion, yeah. So, yeah.
At the end of the 3 motions, if they're adopted, we will actually decide on order.
Thank you for the clarification.
But we only have 15 minutes, so please, everybody, be as brief as you can. If somebody said something, don't repeat it. Just say what he said or what she said and move on, because we got to finish this.
Mr. Elson.
Oh.
Mr. Pulaski.
4.
Ms. Sidhu. Yes. Mr. Bailey.
Yes.
Ms. Conans.
Yes.
Mr. Mazur.
Yes.
Mr. Strauss.
Yes.
Monsieur Thériault.
Wait.
Right? So the motion is carried. Now, then we will decide after the motions on what priorities are. The second motion is from M. Thériault, and it reads que conformément à l'article 108, le comité entreprend une étude sur
The committee undertake a study on antimicrobial resistance, which, according to the WHO, is one of the 10 greatest threats to global public health facing humanity. That the committee hold a minimum of 4 meetings, that additional meetings be added to the committee's schedule if the committee deems it necessary, that the committee reports its findings and recommendations to the House, and that pursuant to Standing Order 109, the committee request a comprehensive response to the report by the government.
Ariane's motion. You have it in English in front of you. So, any discussion on Mr. Therrien's motion? Seeing none, we will take a vote on the motion, please.
Ms. Chi. Mr. Elfson,
Oui.
Mr. Pulaski,
Yes.
Ms. Sidhu, Mr. Bailey,
Yes.
Ms. Gonans,
Yes.
Mr. Mazier,
Oui.
Mr. Strauss,
Yes.
Monsieur Thériault.
Maybe you
Oui.
didn't hear? Yeah?
So, yea, 9, nays, 0. The motion is
Okay,
carried.
so the motion is carried. We will move on to the third motion, which is a motion from Ms. Chi, and it is that whereas it is in Canada's best interest to have a strong domestic pharmaceutical industry that ensures Canadians have access to essential medicine and medical supplies, the committee undertake a study pursuant to Standing Order 1082 of no less than 8 hours examining Canada's pharmaceutical sovereignty, that the committee hear from representatives of industry, academia, and patient groups, and that the study develop recommendations for how Canada can best promote pharmaceutical sovereignty, and that the committee report its findings and recommendations to the House, and that pursuant to Standing Order 109, the government table a comprehensive response to the report. Now, that's the third motion on the table. Discussion, Mr. Pulaski.
I'm sorry, I'm a doctor. I have public health degrees. I have law degrees. I have no friggin' clue what you mean by pharmaceutical sovereignty. So could you explain this term that I'm voting on?
Thank you, Dr. Pulaski. Am I too close to the microphone? Okay, great. The motion is about, how do we, as a nation, how do we ensure we have supplies when there is a shortage? And during the pandemic, we definitely saw what unfolded. So it's more about how do we make sure we have enough supplies when we experience extraordinary circumstances, and even outside of that. And how do we make sure that folks, patients, families have access to medications, much needed medications, when they're presented with such challenges.
Any further discussion? Debate? No? I'll call the question, please.
Ms. Chi,
Yes.
Mr. Elfson,
Yes.
Mr. Pulaski,
Yes.
Ms. Sidhu,
Yes.
Mr. Bailey, Ms. Gonans,
Yes.
Mr. Mazier,
Yes.
Mr. Strauss,
Yes.
Monsieur Thériault.
The motion carries unanimously. So now, process. We now have 3 motions on the floor that this committee has accepted. I need you to prioritize these motions for study. In other words, I'm going to ask you to decide which should be the first one of those 3 motions that we will study. Mr. Pulaski.
So a point of clarification, there's also, we have to finish the woman's study. We are going to wait for the opioid study for a month to get the report back. What are we deciding here vis-a-vis, there's 2 other studies to complete, plus these 3 new studies. What's the order going to be? Are we going to finish those other ones?
Decided on the order earlier on this committee, Mr. Pulaski, but I think we now need to decide, once we embark on studies, which of these 3 will be our first study. After we've done the other work that we discussed earlier on in the committee.
Okay.
Mr. Mazier.
Yes, Monsieur Mazier?
I propose that we do the conservative study first, block study second, liberal study third.
Ms. Sidhu?
Thank you, Madam Chair. All studies are important, but right now I'm thinking if you see in some cities mayor declare emergencies, I think opioid study already we went through so many witnesses and there's so many meetings we did. I think the opioid study is very, very important right now. I think in country we need to pay attention on that side. As Mayor declared the emergencies, everyone knows that how many deaths are happening, and then this is a very, very important study, opioid study. And
We're not voting on the opioid study. We already voted that we would get the report and then embark on the study. We're waiting a month for the report. We're discussing which of the three motions you just passed would be the first one. In order of priority, Mr. Mazier suggested that his be the first, that Mr. Theriault's be the second, and that Ms. Chi's be the third. Ms. Chi.
Thank you, Madam Chair. And from my understanding, the women's study is already ready to be reported out, or is ready at the... Right, let me finish, yes. And I think it's very important that it's also a study that had a lot of witnesses, a lot of experts, and it impacts half of our nation. It's very important to a lot of folks in the room and beyond. So I would really like to see that presented soon, next week. And as in the order, I would actually propose, we study Mr. Theriault Bloch's study first. And a liberal study on pharmaceutical sovereignty, and then followed by the CPC study.
Okay, Ms. Conant, Mr. Bailey. Any other hands up? Mr. Pulaski?
As I mentioned earlier, I am very interested in the women's report, but I didn't actually notice that we had a vote on putting that as the first study. I think that having the conservative study go first and the list that MP Mazier mentioned in order as for the women's study, give us a couple months to look at that. And as I said, I'm sure it'll be very interesting, but that's not something that we all voted on actually looking at least not until we see the report.
Madam Chair, with the shortage of physicians in Canada and a couple of provinces actually making some headway, we as Conservatives would like to bring some information to light that might help other provinces. The importance of this study needs to be looked at immediately, hence why we've asked that it be first on the list.
Mr. Bailey? Sorry, Mr. Bailey, you just spoke. I'm sorry. Mr. Theriault? And then Mr. Pulaski.
I have absolutely nothing to say about that, apart from the fact that for the Conservative motion, I explained my reservations earlier, and I indicated the limits of that study. Therefore, if the limits were respected, I thought it a good idea to shed light on the situation. That's why I support that motion. And as a new motion, after the report on women's health that we have to dispose of when it's tabled, I would support that it be the first topic dealt with. That's no problem. I'm in no rush to go to my own motion. I'm very generous.
Any other further discussion? Mr. Pulaski, sorry.
So I know, having sat on this committee for 6 years, that when these other studies, when the women's study is back to us, and if we want to give it a couple months before finishing that, that's fine with me. The opioid study, and I understand it's going to take a month to get out the present evidence, but I agree with Sonia that whatever other study we're going to start first, I would like to see us interrupt that to finish the opioid study. The opioid crisis is a gigantic problem, as I think we all know, across Canada. In many of our ridings, I know in Thunder Bay, the opioid death rate is similar to what it is in Vancouver. Your riding, your municipality, Hetty, but it's also closely tied with the homelessness crisis, the mental health issue. We've all seen the deteriorations in our downtown cores as a result of open use of opioids. I think this is a problem that many Canadians are concerned about.
Excuse me, we're actually speaking to the priority of 3 motions on the floor right now.
With due respect, Hetty, I too am
we
talking
agreed to
the
this
priority.
earlier on, Mr. Pulaski. We have 5 minutes to go.
Well, I would like to, let me...
So there are no further resources to meet after 1 o'clock.
We're speaking to the motion and to the priority. So again, I repeat, given the severity of the problem and the number of deaths of young people due to the opioid crisis, that when we have finished and the analysts have sent out the report from the witnesses we've already seen, that we go back to the opioid study, whatever we're doing, in order to finish that. Because I think overwhelmingly this is a health crisis that we need to be dealing with.
Ms. Sidhu?
As we are three past members, Mr. Turio, Dr. Pulaski, and myself, and I urged the committee, we did a lot of hard work, 86 plus witnesses in women's study. If we can look into everything is ready to go. If we can look into the women study first, that's what I just want to make a point.
Okay, I think we all agreed that we have the women's study printed, that you agreed to send it out to the new committee. So that should be in your hands, I would suggest, in a day or two. So that would be one of the first things. We're now talking about specifically the 3 new motions that were made and how we prioritize that. So I think we've heard that Mr. Major wants it first. I want to hear what the others say, and then we're going to vote on Major, Terrio, and Liberals in terms of order of how we do this. So you had your hand up, Doug, and then Mr. Major. Oh, Ms. Conan. Sorry, Ms. Conan.
I was just wondering why we didn't go for a vote. That a motion has been made.
Could in a minute. People are still debating this issue, I think.
In 2 minutes.
Ms. Conant, you have something to say on the issue of the priority?
I agree with Mr. Major's priorities. It's motion. It's been the motion has been made. Let's take a vote.
I have to wait until all debate is ended. I have names on the list, and so I have to call them because you're debating Mr. Major's motion. Okay, Mr. Major, and then Mr. Elfin. Elfson. Gosh, you're a tongue twister of a name, Doug. Okay, go ahead.
I just take some fine points on Ms. Chee's comments about the order. It's usually official oppositions, Conservatives, then opposition, Bloc, and then government, Liberals. That's usually the order because of the committee, so just to bring that to everybody's attention. So that's why I would move, and we can have a vote.
Right. Before we do that, we have Mr. Eyolfson to speak. He had his name up. The debate is not ended until everyone has had their hands acknowledged. But we're now at the end of 1 o'clock. We're going to have to get to moving on voting on this soon. So, Doug?
Yeah, very quickly. I was in favor of Ms. Chee's motion. The priority of antibiotic resistance. It is a very pressing issue. As is the issues with, we just went through a pandemic, and we know the issues with availability of medications. And so for that, we need, I agree with Ms. Chee's motion on Mr. Terrio's being first.
Thank you. I think I just heard from the clerk that we have a few more minutes that we can stay over 1 o'clock. She just heard from interpretation services. So we still have some time. Is anybody else's hand up? If not, we're voting on Mr. Mazur's motion that said, so we have more people. Okay, Ms. Chee and then Ms. Sidhu.
Thank you, Madam Chair. And to Mr. Major's point, I believe what the order you're referring to is referring to questions, not for motions. So I'd just like to put that on the record as well. I also want to add my support to my colleague, what Dr. Pulaski was just referring to in terms of opioid study, because it's such an important issue impacting so many families, and just want to add my support to that. And my last final comment is on my motion to the committee, the pharmaceutical sovereignty piece. I think it's just, we've seen over and over again the importance of having that as we, move forward, plan ahead, and it's just to support the families around the country so they no longer have to, scramble for resources, scramble for pharmaceutical products. So I just want to really emphasize on the importance of that. Thank you, Madam Chair.
Sidhu?
Madam Chair, I think before that in subcommittee we agreed all the three studies, right? Now the set up the priority. Priority being, as my colleague said, the opioid study after women as health opioid study. And
Decided, Ms. Sidhu.
No. After, I'm coming on that point. Antimicrobial resistance, we all know that how important it is, right? So when we set up, we are studying everything. The matter is now the first thing. Let's go on the antimicrobial resistance study first, and then after that we are not saying no to the other studies, but the priority is the important thing is that study first. Thank you.
So Mr. Pawlowski?
I just want to bring up, we had, under the previous committee, decided on the next study. It was the cancer study. We have not seen fit to prioritize that. I think that was a big mistake. I think we all know many people affected by cancer. Our committee has not studied this in 6 years. I know the Canadian Cancer Society is certainly really promoted, was in favor of the cancer study. So I just put notice out there that I certainly hope all the other members of the committee remember this, and that at some point we adopt the previous study that was approved by all members of this committee, which is the cancer study. Because the number one death of Canadians is cancer, not antimicrobial resistance, not the lack of drugs, et cetera, et cetera.
Very much, Mr. Pawlowski. Now, I think there's no further debate. I would like to be very clear what we're voting on. Mr. Major suggested that we vote first, priority number one, his motion, then Monsieur Thériault, then Madam Cheese. And so that's what we are voting on. If you agree with Mr. Major's motion, you will be voting yes. If you do not agree, you will be voting no. Just to be very clear on what we're voting on. Thank you. So, Clerk, go ahead.
Ms. G.
No.
Mr. Elfson.
No.
Mr. Pawlowski.
No.
Ms. Sidhu.
No.
Mr. Bailey.
Yes.
Ms. Conance.
Yes.
Mr. Messier.
Yes.
Mr. Strauss.
Yes.
Monsieur Thériault.
Oui.
So yes, 5.
The motion is carried 5-4. So in terms of the priority of the new motions, it will be the order that Mr. Major suggested. So thank you very much. Yes, Mr. Major.
There was another motion there that the committee invite the Minister of Health to appear for 2 hours, no later than October 10th, 2025, to discuss her mandate. That was a motion that was tabled before, and we haven't talked about it. So.
There's a motion on the floor that the Minister of Health be. Can you please repeat it so that everyone knows exactly what the motion says?
That the committee invite the Minister of Health, Marjorie Michel, to appear for 2 hours, no later than October 10th, 2025, to discuss her mandate.
Thank you. Discussion on the motion on the floor, please.
C'est strictement un point d'ordre, Madame la Présidente.
Just a point of order, Madam Chair. For the record of this meeting, I would like the motion that was adopted on opioids be worded exactly as I tabled it. I would like that motion to be worded exactly as I tabled it. Do I have to read it? Because
Already.
On parle du fait qu'on a donné.
we're talking about the fact that we gave the analysts a mandate to start an interim report, but we never talked about the wording of the motion, and it seems to me important that that wording appear in the record. I can read it.
The exact motion is here to go into the record. Would you like to read it, Mr. Thériault? We already voted on it, but go
Parfait.
ahead.
que le comité considère que tous les témoignages et toutes les preuves reçues par le comité au cours de l'étude sur l'épidémie d'opioïdes et la crise des drogues toxiques au Canada ont été reçus et adoptés, qu'un rapport intérimaire soit produit et déposé au comité avant que l'étude ne continue, que le comité tienne 2 autres réunions pour entendre les témoignages des témoins afin qu'il puisse faire ses recommandations et déposer ses conclusions à la Chambre et que, conformément à l'article 109 du règlement, le comité demande une réponse globale au rapport du gouvernement.
The translation is obviously not, so perhaps you could read it in English or I will. Oui, c'est-
Yes, in English, please, because interpretation wasn't working. I'll try.
Consider all testimony and evidence received by the committee during the study on the opioid epidemic and toxic drug crisis in Canada to have been received and adopted, then an interim report be produced and tabled before the committee before the inquiry continue, that the committee hold 2 more meetings to hear testimony from witnesses so that I can make it recommendation and table its finding in the House, and that pursuing this to studying order 109, the committee requests a comprehensive response to be reported by the government.
Monsieur Thériault.
Pardon?
Excellent.
Oui, merci, Madame.
Thank you, Madam Chair.
Okay, all right. It's just been read into the record. That's all, because we already agreed to adopt Mr. Thériault's intent. Monsieur Messier, something new?
I brought in the motion to ask the minister. That's what we were in the middle
I
of.
know we were. He wanted to read his motion, which we'd already agreed on. So now we've got the motion on the floor about inviting the minister. Any discussion on this motion?
Bit of clarification, if I may. So I just want to clarify that the official will also come, so that it will make a very comprehensive conversation with the committee.
I don't think ministers come on their own. They usually come accompanied by officials. So any other discussion? Can we vote on Mr. Messier's motion, please?
Sure.
Do you want a recorded vote, or can we just go those in favor? Okay, it's unanimously passed. Thank you very much. Yes, Ms. Chi.
To adjourn the meeting, please.
All right, meeting adjourned. Good. Thanks.
Thank you.